Give me a wave at the back if you're awake and can hear me. That's double up. Good, thank you. Having spoken at a number of conferences, a lot of the US speakers tend to give you quite a big presentation about how their family, their background, etc. And I thought, I'll do this time because I'm British and it's quite painful, and no one's done it at all so far today. So I'm sorry about that, and I'm also a bit embarrassed that Alex Butler's got his own logo. How good is that? I don't have a logo. A little bit of background to me. Probably the hobbies bit the most interesting. Stand-up comedy, singing and Welsh rugby. A lot of my friends think 3 of those things take place at the same time, which is a little bit rude. And sorry ladies, I am married. A couple of ladies down the front here looking physically sick, so thank you for that. I'm going to talk today about how to engage with a doctor online. Interestingly, I changed the title of this twice from how do you engage with doctors online? And this morning I was thinking, should I change it again to how do you engage with each doctor online? And there's a key point here, and Alex mentioned it this morning about personalisation and specialisation. I think it's a very important point. A bit of background to, shall I walk around the front? I want to walk around the front. A bit of background to the company. It's the largest professional network of doctors, and it was very interesting this morning to hear Renee and Eric talking about building communities. The pain that this company, DoctorsNet UK, has gone through over 12 years to build this community, and the money that it spent, is ridiculous. So to build communities is very, very difficult. The other interesting point from the people that contributed on communities this morning, I thought was also noticeable, was the question was asked, who here has built a community? And what's interesting with this community is it was built by the doctors. So actually, David, diabetes.co.uk, probably again the patients may be heavily involved in building that. But actually, what's happened is here, the company hasn't built a community, the doctors have built a community. We have a big website, lots of information on it, lots of data, lots of stats, lots of collaboration, etc. The interesting point on this slide, if you look top left-hand corner of the screen here, is your profile is consultant in oncology. Every single doctor is profiled by speciality, by seniority, by geography, and by behaviour. So when you log into the site as a doctor, if you are a consultant oncologist, you have a completely different web experience to a specialist registrar in dermatology. So it's a completely different experience. The site map is huge. One of my favourite comments from clients when we present to them sometimes is, this is a great idea. Why aren't more people doing this? Now, there are over 25 different services over this website, on this website that have been created over the past 12 years. A huge amount of information has gone into this. My other favourite comment is, have you thought about nurses? As if we could knock something up overnight and then tomorrow have, maybe 100,000 nurses all engaging online. Very, very difficult to do. And a couple of the last bits for you is some stats. We've just started reaching now 40,000 unique doctors every day, which is a pretty big number. 12 million page impressions every month. 50 different specialities, and you can see some of the other stats on engagement. 45 times each month, 25 minutes for each visit. Interestingly, the visit stat only includes log off, so it doesn't include time out, where somebody could just go and have a shower and then they'd be timed out from the site. And another important point is sponsored campaigns. We make money by commercial partners sponsoring campaigns on DoctorsNet UK. That isn't just pharma. We work with Virgin Atlantic, we work with Apple, BlackBerry, public sector bodies, Department of Health, recruitment companies. Anybody who has a strategy to get to doctors often comes to us, so it isn't just pharma. I'm sorry about Northern Ireland. I'm always worried. Northern Ireland seems to be omitted from that heat map. It's not, we haven't got anything against it. It's purely down to human error, so sorry. And this morning I Googled doctors. I'm kind of pleased and unhappy at the same time. I'm pleased that we've beaten Wikipedia in the 236 million research results. I'm not so chuffed that we've been beaten by a BBC One television programme called Doctors. I don't know how much they spend on SEO. Interestingly, we don't spend anything on SEO, but we're still at the number 2 slot when it comes to that. We also focus on specialist areas. We target specialist groups. So when a doctor comes in, if you look at the haematology information here, when a haematologist comes in, they get specialist haematology information, which is really important. And we're also coordinating international solutions, looking at working with other networks across the world. Quite difficult to do, but actually most pharmaceutical companies are looking for a unified strategy, a unified opportunity to actually communicate with doctors across the world. Right, that's mine. I'm going to go back up here now. I feel a bit more like Obama up here. It's quite good. So that's a bit of background to the company. One of the things that we obsess about is understanding doctors. We tend to focus quite heavily on this, and one of the bits of feedback we constantly give to our clients is, what do doctors want? And I just want to run through some of the information and some of this is new research. Literally in the last 12 months now, professional search, so where a doctor is using Google, even using Bing, to actually search for things online, the professional search now has become the #1 element. This has changed hugely. So actually now the internet is part of a doctor's daily life, which is really important. We also even know things about doctors as to what they do out of work. We, having worked with Apple and BlackBerry, we've had some interesting discussions with them sharing some of their customer segmentation. And they go down into the nth degree saying, what do doctors want? How are they profiled? And it's important for us as well to understand some of this information. Also, basic things like iPods. This research is from the middle of last year. So again, as we know with the internet and technology, they move very quickly, but 50% of doctors are already saying they own an iPod. Now that means that's a potential channel for any company, any partner to get to doctors. We also know iPhone utilization. Simple bit of maths I wrote down here. We have roughly 65,000 doctors who use the website every month. 8,000 in August who used their iPhone to log into the website. So rough maths, about 12.5% of our doctors are actually using their iPhone to log in to the website. The website is not even iPhone compatible. So we haven't done that yet, and they're already using it. So this is something that I think people will, we all know how iPhone is growing and applications, etc. It'll be an important tool moving forward. And with that information, what have we done? Well, we've developed an iPhone application for medical news. We know medical news is the most important, one of the most important areas of the site that doctors view continually on a daily basis. So we've developed an iPhone application to do that. It's publicly available, over 15,000 downloads to date. So there are a lot of industry people who download it as well. So feel free to do so. And the other thing we understand and we research regularly with the doctors is, what do you want from sponsored content? What actually do you want that to look like? And we feed this back to our clients all the time. Clinically relevant content, benefits my practice, timely and topical, source is clear, and it's targeted to my profile. And this is really difficult, and I'll talk about this in a couple of the slides nearer the end. The internet is the most brutal and unforgiving medium of communication. I was chatting to Rene, and I'm not going to steal his thunder on this, but actually, if you give any user, not a doctor, any one of us, content or a website or material that is of no use, you're gone within 0.5 seconds. That means for the pharmaceutical industry to engage with doctors, patients, healthcare professionals, whoever it is, you have to give them information that actually satisfies at least 3 of these criteria to get it right. It's tough. Also, understanding doctors, I've spoken a bit about specialists. Also, GPs are important. Actually, GPs are a tougher group to get to because by the nature of their title, they're generalists. They often specialise in certain areas, but actually they cover a huge array of different disease areas. This is looking at their professional practice. This was in November. I would imagine this data has already changed. If you look at number 4 here, service redesign, commissioning, those of you that are from the UK will be very aware of the white paper and the changes that will go on within the health service. I would imagine that if we did this today, service redesign may be right at the top. But in November they told us relicensing and revalidation. So what our medical team did immediately was pull together a revalidation microsite. So we created content, we brought an advisory board of GPs to actually help us create this content, and again, it was a need for the doctors to receive this information, and we helped them by doing the following. We also looked at talking to GPs about what online resources do you find useful. The #1 thing that a GP wants is accredited ECME modules. That is really important to them. And that also is based on the revalidation requirement that they have as well. So it's important that actually you give them this. Interestingly, for specialists, ECME modules score quite low, probably because specialists, particularly at consultant level, feel they're already well trained and don't feel it's such a need for them. Right. A couple of other bits of research that we've done this year to try and understand doctors. We ran some 60-minute online discussion groups. We took 13 GPs, got them for an hour and talked to them about various elements of the website and other elements of online campaigns. Did some, sorry about the quality of this slide, but you can see this gentleman down here who's a doctor, and we did all the classical eye tracking work with him moving his mouse around to find things on the website. We asked them questions about where would you go for this information, how would you find it, where would you go for sponsored campaigns. Did a huge load of work in this area, really, really fantastic. And that informed the way that we actually continue to develop the website. A couple of the interesting bits are, and this data was produced by MediConnect Healthcare Insight, which is the research part of Doctors.net UK. And they called it the golden triangle and the secret of success. And what the research team said were the three things that are crucial. Interesting subject matter, time available to interact, that comes through quite a lot, and clinically relevant at the time. That was what they talked about, these GPs. We also asked them specifically about webcasts. We get a lot of, oh, I must do a webcast from pharmaceutical clients, or we've got to do a video, or everybody's doing it, get webcasts online. And we asked them what were the barriers that you needed to overcome to actually make a successful webcast. The number one response was time required. It's still time, and we still have pharmaceutical clients saying to us, we've done a 29.5-minute video of conference X, could we put it on your website and get doctors to view it? Too difficult, it's just the time thing is an issue. Interestingly as well, bandwidth was an important point. You'll be aware within the UK that the NHS, sometimes the bandwidth is pretty low. It's really difficult sometimes with complex flash-based video to actually even download it in time. Some of the qualitative feedback from these GPs was also interesting. Use the internet in small chunks, duration, they're too long. And one of the key points that was a bit of a nugget for us is this, and I've bolded it out in the slide here. My other dead time is usually in the car, and I haven't an easy way of listening to a webcast here. So one of our bits of learning here is actually, if you talk about a doctor driving to and from work, that is dead time where they might be quite interested to listen to information, to listen to a podcast. So within our iPhone app, we've developed podcasts. It's something we do more on the site to get doctors to download, because we know that that's actually in the car where they may actually listen to a 30-minute audio footage that they've downloaded. So it tends to be something that's quite important.